Welcome back to the Lars Larson Show. Yesterday, we heard from Dr. Anthony Fauci and other experts about the future of quarantine and shutdown and stay home, stay safe, and all the rest of that. But where we sit, how clear was the answer? When can we reopen? Well, I thought we'd talk about that with a real expert, Dr. Kevin Pham, who is a contributor at the Daily Signal, former graduate fellow in health policy at the Heritage Foundation. Dr. Pham, good to have you back.
Thanks so much for having me back.
So what did you take from yesterday's, and do you think we got a clear message about whether or not it is smart for the states to start the reopening process?
I don't think we got a clear answer to that, and partially that's because there is not really a clear answer to that. One of the biggest problems with trying to come up with some kind of definitive answer for the entire country or in each individual state even is that we're not dealing with something that's easy to define. We're dealing with something that's a very delicate balance. And quite frankly, it's too late for a right answer. What we're looking at now is a series of wrong answers. The best answer is going to be the least wrong answers. So the sort of cautious approach that Dr. Fauci is taking, I can understand why he would do that sitting from the White House and the Capitol. But if you zoom in on different parts of the country, you'll be able to see that there's a lot of states that are, or at least a lot of counties that are fairly untouched by the virus, and I think those places should have the opportunity to reopen sooner, if not immediately.
Well, in fact, if you look at the total number of counties, I've had people make this point before, and I agree with it, that there are a lot of places that do seem relatively untouched. My concern is if we do a reopening, the places where I guess it's where the disease comes from and where it goes, because you don't necessarily get the disease where you live. If you say you commute in from a rural area or a suburban area into a city, it may be that the cases show up in the suburban area because that's where you live. It's not where you work and it's not where you got the disease. And the same kind of thing could happen to the rural areas. But I would love to see them start opening up some of the rural areas that have been, as you say, relatively untouched. And then, I guess, sort of evaluate it as it goes. If you start to see an uptick and a sharp uptick in cases, then maybe you say, well, you have to modify some of the things you're doing. Is it possible that we can do it that way? And if so, why weren't we doing it that way at least a few weeks ago? Or was the whole country so focused on New York City that we were waiting for New York City, which is a bit of an outlier when it comes to coronavirus, isn't it?
Oh, yes, certainly. There are no other cities in the country that are like New York City. Even the other densely populated area, probably the closest would be either Chicago or San Francisco, where they do have a lot of public transit dependency, but not nearly to the extent of the MTA in New York City. Pretty much everyone relies on the subway system there, and that's been probably the source of the greatest amount of spread in New York City. What we've seen in the past week or so is that there's been a steady decline in cases from New York City or in New York City. So I think that's good for the rest of the nation because most of the nation was infected by seeds coming from New York City. So moving forward, that will be a good sign for the country when New York City starts coming down. But you're right, we don't have to wait for New York City to be perfect for instance, Wyoming, Montana, or Idaho to start reopening most of the state because, frankly, I think two counties in Wyoming and two counties in Montana have cases, and that's about it. I'm looking at the visualization that Heritage has. You can find that at heritage.org/data-visualization. It's a really neat map. You'll see most of the country doesn't have any rises in new cases in the past 2 weeks, which is a pretty remarkable thing. So I don't see why those places should be held back.
Well, and in fact, some of those places, I'll give you an outlier case, Dr. Pham, and I'd love to have you comment on it. And I guess this goes to my point about commuting. Some of the folks I know in Idaho have said, yeah, the state doesn't seem to have much of a problem, but the one county that does is where else? It's Sun Valley. And why? Because a whole bunch of people come from other parts of the country into Sun Valley. And it sounds, I mean, you hate to just, broad brush, but understand that I'm aware of the hazards of broad brushing, that it looks like Idaho didn't really have a problem, except the cases of coronavirus brought and spread to a playground for people from other parts of the country.
Right. That's going to be a major issue as we're starting to try to lock down cases where they are. And part of the response to that is probably going to be for harder hit areas to relax at least a little bit because people are going to want to leave their area if they feel like they're living in a prison. If you're living in, for instance, Los Angeles, that might be locked down until August perhaps. there's a pretty large impetus for someone to get in a car and drive to a different state, and they may be driving a case of coronavirus with them. It's hard to tell at this point. But if you feel a little bit more freedom in Los Angeles, there's not a lot of reason to leave when you have palm trees and beautiful beaches, if you can use them.
Yeah, if you can actually use them. And the other issue is I hear people saying, and I've actually had a few people email me and say, Lars, you're being a fool. You keep talking about the asymptomatic cases and they don't spread it. And I wrote back and said, look, I'm not a medical expert. My understanding is asymptomatic people who have coronavirus, if the virus is active in their body, are shedding virus just like somebody who has symptoms. Is that true?
Yes, it is. In fact, most of the cases, at least the data suggests that most of the cases that have been spread by asymptomatic or pre-symptomatic carriers, people who didn't develop symptoms until a day after they've exposed their entire community to it. And the other thing, too, is that it's not just asymptomatic people, it's also people with just mild symptoms. If you have sort of a head cold or a cough that lasts a couple of days, it's not always clear that that's a case of coronavirus. It might be, and if it is, then you could have spread that to someone else, but it would be virtually indistinguishable from a cold or a sinus or a sort of a sinus flare-up. So these people are able to spread the virus all around without knowing it, and that will be a major problem. We should people have to be mindful of how they're able to spread the virus.
Well, and Doctor, I want to ask you about a study, and I hate to hit you with kind of a surprise question, but it came out yesterday, but it occurs to me to ask you about it. The study, I guess, is going to be published in the next few days, but it's out of Japan. And it basically, the basic layperson version of it is, if 80% of us could be counted on to wear masks somewhat routinely, just to make sure all those droplets and particles don't get in us, that we might be able to dramatically cut the number of coronavirus cases. But do you think that's the kind of public health policy that Americans are willing to embrace? And I mean voluntarily. I can't imagine a government mandate that you have to wear a mask, although we are seeing them at airports and on airplanes and in certain specific situations. But do you think we could get Americans to embrace the kind of thing that Asians in certain Asian countries have done routinely?
There's going to be a lot of resistance against that. In fact, I've already seen a lot of resistance against even just the culture, not even the mandate, but the culture of wearing masks. It's not something that Americans are used to, and I don't think that necessarily, for instance, Lima, Ohio will necessarily need to wear masks all over the place. But if you're talking about travelers in LAX, then it would certainly be beneficial to not just the airport, but the community around the airport and the community that airport connects to. So the people in the airport or in Los Angeles are wearing masks because, again, those asymptomatic carriers, if they're wearing a mask, then it's very difficult for them to spread the virus anywhere.
Hey.
But we should remember that wearing a mask is a supplement. So if you're feeling any kind of symptoms or you've been exposed, it's better just to stay inside and be separated from other people. And wearing a mask does not replace hygienic practices like washing your hands and not touching your face.
Dr. Pham, I want to throw one other one at you. I haven't heard anybody talk about HVAC systems, especially in public places. I know that to some extent I've read some studies that talk about spread where an office, the folks, if there's an airflow from one end of the building or from one end of an office to the other end, people downwind of an asymptomatic person end up getting it. Is there any thought to saying that while we've made things tighter and tighter and tighter in name of energy efficiency, that maybe it's time to start increasing the airflow and being less concerned about energy and more concerned about perhaps lifting the viruses and particles out of a given space like a restaurant or an office or a gathering spot and getting them away from the people? So, because I know what they were trying to do is circulate as much air as they could and keep it inside the building because of concern about cost and energy.
I've seen some of those studies, and at least one of those studies suggested that the HVAC system was sucking in infectious particles and then distributing them through the system.
Oh God!
That would be horrendous. But I think that's not a very well designed system, and that was in China. That one.
Well,
so that's probably not going to be a reality here. At least I don't believe so.
And maybe we need to go to some ultraviolet light inside those HVAC systems. Dr. Kevin Pham from Heritage, thank you so much.